Hello, this is Nadine, also known as the Gluten-Free RN. Welcome back to episode 12 of the Gluten-Free RN podcast. Today, in episode 12, we're going to talk about some of the neurological issues associated with celiac disease and non-celiac gluten sensitivity. This is a very big topic, so we may actually designate several of the episodes to this large topic because celiac disease is actually primarily a neurological disorder. It's not primarily a gastrointestinal disorder, although some people have either gastrointestinal symptoms or neurological symptoms or both. So stay tuned for neurological issues associated with celiac disease and non-celiac gluten sensitivity. Hi everyone, I'm Nadine, the Gluten-Free RN, and today during episode 12, we're going to talk about neurological issues associated with celiac disease and non-celiac gluten sensitivity. This is a very big topic. One, because people have a lot of neurological symptoms that either get diagnosed as something else or they get diagnosed and really are told that there's no hope for them, or they have to take very caustic medications or chemotherapy type medications. So today we're going to talk about finding out if the cause of your neurological symptoms could potentially be caused by eating gluten. It's crazy to think that our neurological system can actually be affected by what we eat, but it makes a lot of sense medically and in every other way possible. Let's start off by talking about a lady that just came to see me most recently. And if you think it's about you, it's probably not. There's a melding of several patients in here or people I see for consultation. So I'm just taking some very key points from several of the people that I talk about with their neurological issues. I did most recently see a lady, and she had to retire early because she was essentially immobile. She had to use a scooter or a wheelchair and canes, all types of walking assistance. They diagnosed her with MS, and then they said, no, you don't have MS. They tested her for everything. She was seen at the Mayo Clinic, and nobody could figure out what was wrong with her. But what was clear was that she was actually becoming debilitated. It wasn't until she read Dr. Terry Wahls, Wahls book on the Terry Wahls Protocol. Dr. Terry Wahls, who you've heard me talk about before, had debilitating MS, as she was diagnosed with, and now she is up and walking. So this lovely lady decided that she was going to go on a paleo diet 5 years ago. And she did. And she said, hey, it was like a miracle. I could walk again. I wasn't debilitated. And now I can take nice long walks. The interesting thing is that she said, I don't like to talk about it unless people ask me, because I lost a lot of friends when I became sick, when I couldn't walk anymore. And she said she even lost friends after she got better because she had adopted a paleo diet, which sounds a little odd, but it's actually reality. I myself have, when I got sick, there were people that wouldn't be my friends anymore, I guess. And then when I got better and started talking about going on a gluten-free diet and then a paleo diet, other people wouldn't return my phone calls. So that's reality, and that's okay. I'm on my journey. They're on their journey. And a lot of the people that do get better realize that, maybe if those people didn't want to be friends anymore, then they just have to move on. We'll find new friends, which we do. Amazingly, there's a huge community of people that are changing their diet, adopting at least a gluten-free, dairy-free diet or a paleo diet, and they're getting better. So once you change your life in such a positive way and people see that, a lot of people actually want to enjoy that also. So one of the ways that we can influence people is just being a positive influence, a positive motivator, a positive, hey, look, this happened to me. It could be what's causing your problems. And so it's worth investigating. We also know that a lot of people don't want to give up their food or even talk about it, which is interesting. Food is such a powerful medicine or a powerful drug or a powerful poison, believe it or not. But people really honestly do not want to talk about their food. It's interesting. They feel threatened, or, if they had to give it up, they would feel very sad or they get mad. So, and I actually completely understand that. For a long time, I was addicted to carbohydrates, bread, pasta, pizza, beer, and I could not imagine what else I would eat. Now, 10 years later, I can't believe that's all I ate. My food that I eat is so good and so nutritious and so amazing. As Pete and I talk about all the time, it's like eating gourmet every day. So this lady who changed her diet 5 years ago no longer is in a wheelchair. She walks just fine for miles. And one of the reasons she came in to see me because she wanted to be reassured that she would continue to get better. Because she had felt she had reached a plateau and there was nothing that was going to continue to make her better. And she was just going to have to live with the things that, had kind of settled out with her health. And we talked about that quite a bit. And our bodies want to get better. Our bodies want to heal, but it does take time, especially when there's neurological damage involved. So once that neurological damage actually happens, your neurological system can heal. It wants to heal. It does take just a considerable amount of time. 8 years later, I still had neurological issues, but now 10 years later, my body, for the most part, neurologically is healed. That being said, I also recognize that there's probably neurological damage that was done, but overall, my neurological health is much improved and I don't have balance issues. I don't look like I have MS anymore. I don't fall and I feel so much better. So interestingly enough, one of my favorite practitioners is Dr. Hadjifasiliou, and I saw him at Columbia University several years ago now, and he gave a great presentation on the neurological component of celiac disease and non-celiac gluten sensitivity. And he talked about several patients, and he actually showed great videos of people that couldn't walk straight, or they had tremors, or monoclonus, which is more of a, jerky motion. And I asked him after his presentation what those patients had been diagnosed with before they went to see him and got a diagnosis of gluten ataxia, whether that's celiac disease proper or non-celiac gluten sensitivity. And he said a lot of those patients had been diagnosed with things like Parkinson's, ALS, MS. He even said one of the patients was diagnosed as psychosomatic. And I thought, what? And I said, they told him he was making it up? And he said, yes. So this poor patient who was told he was making his neurological symptoms up and pretending actually died of his undiagnosed neurological damage from celiac disease at a rather young age. So Dr. Hadjifasiliou's message was, we have to find these people. We have to find them relatively quickly before damage is done that we can't reverse. So I'm telling you today that it's very important to find out if you are affected by either celiac disease or non-celiac gluten sensitivity. And Dr. Hadjifasiliou is a great advocate for including an AGA or an anti-gliadin antibody in the testing for celiac disease because it is a great biomarker for non-celiac gluten sensitivity, even though it's not very specific for celiac disease proper. It is actually a great sensitive biomarker for non-celiac gluten sensitivity. It means that your body is actually producing antibodies against the gliadin protein. So why is the neurological component so large? Well, if you take into consideration that your entire enteric nervous system is located in your bowels or in the mesentery of your bowels, then it really starts to make a lot of sense that part of your neurological system that is located in your intestines and in your bowels is actually centrally located where it is affected by gluten and every other thing that you consume. So this is one of the primary reasons I talk a lot about constipation and why constipation is not a lack of fiber and water for the most part, for most people. It is a neurological issue. Our intestines actually move with what's called peristalsis. It's both circular and longitudinal movement that moves the food that we've eaten along through our intestines. And if that peristalsis is actually paralyzed because of neurological damage in the intestines, then that food that we eat cannot move through the GI tract or the intestines appropriately. It pretty much just gets packed in, which is how a lot of people get things like megacolons or constipation. So we really want to make sure that we're testing everybody, children, older people, adults, anybody that has constipation for celiac disease proper and also non-celiac gluten sensitivity, because we know that constipation and or diarrhea, you can have both, actually are great first symptoms of undiagnosed celiac disease and non-celiac gluten sensitivity. I've also included in the show notes a great link to a video that I show for all of my lectures that I give on neurological issues. And if I'm doing a lecture specifically for children, I'll of course include it. It's a video from the Discovery Channel and it's on Eamon. And Eamon was a baby and he had severe neurological issues. And it wasn't until his mom actually pushed for him to get tested for celiac disease, she herself had been tested for celiac disease, that they determined that Eamon actually suffered from celiac disease also, but the neurological symptoms were his primary presenting signs and symptoms of undiagnosed celiac disease. So once he was on a gluten-free diet, his symptoms went away. It's miraculous every time it happens. But until the symptoms are dealt with a gluten-free diet, then your body can't get better. So we have to remove the things that are causing the damage and then eat the appropriate foods, heal the intestines, heal the immune system, and eventually heal our neurological system. So what are some of the neurological symptoms associated with gluten intolerance and celiac disease? Well, there's celiac cerebellar ataxia, which is very well documented. It's damage to the cerebellar part of the brain, which is very important for balance and proprioception and making sure that your body knows where it is in space so that you don't run into things and you are able to maneuver your body through space without actually falling or running into things. So people that are clumsy or fall a lot or stumble really want to look at celiac disease as a possible cause for that. So celiac cerebellar ataxia, headaches, and that's generalized migraine, intractable headaches that some people have a low-level headache every day, and they don't even realize it until it's gone. Brain fog, neurological issues related to touch, so sensory, either hypersensitive or, sometimes people just have a hard time holding on to things because they cannot sense that they have something in their hand or it doesn't feel right. Loss of balance or coordination, neuropathies, both in the hands and the feet, and it can be really anywhere. I see a lot of people with facial tics, Tourette's, Interestingly, facial tics primarily on the left-hand side of the face, and I'm not sure why that is. I do see some people on the right side, but most of the facial tics are the drooping or the interesting things that happen on people's faces sometimes happen on the left side. Again, I have no idea why that happens. If anybody does, please let me know. But because gluten intolerance and celiac disease are systemic, we actually have to look at the neurological components and try to fix them really quickly, because sometimes that damage occurs and we can't fix it. And the goal is, of course, as a nurse, my goal is to help people get better. Go figure. And one of the quickest and easiest things to do is to change the diet and see if people do get better. This is not hard. It doesn't have to be hard. Please don't make it hard. Think about your long-term health. Nobody wants to get dementia, or as a nurse, I have a hard time saying Alzheimer's, because the only way we can really diagnose Alzheimer's is on autopsy. So I have a really hard time when my patients come in and they say, well, my doctor just diagnosed me with Alzheimer's. I'm like, really? Because technically, nobody can do that until you're dead and they do an autopsy. Then they can diagnose Alzheimer's, but not until then. Unfortunately, we have a lot of drugs now that people are being prescribed for early onset Alzheimer's or many other forms of dementia. And really, through my work and through a lot of other practitioners' work, we have determined that some of these dementias and Alzheimer's and other things are actually either, one, preventable, or two, treatable with a simple diet change. It's crazy. I would love to do a study in an Alzheimer's unit or in a dementia care facility where all the patients actually that live there get fed, ideally, a paleo diet. I think it would be fascinating to find out how many of those people actually improved, got part of their brain back, or significantly improved so they don't maybe have to live there anymore. Trust me, I've seen it. And until you see it, it's hard to believe it can actually happen, but it can, and it has. So a lot of these people with migraine headaches, seizure disorders, mental health disorders improve on a simple gluten-free, dairy-free diet, but they get much better quicker on some version of a paleo diet. And I do recommend, when people are motivated and they want to get better faster, to start on some variation of a paleo diet. What a paleo diet is, it is meat and fish, nuts and seeds, fruits and vegetables. That doesn't sound like a lot of food, but trust me, it's a huge amount of food. And there's lots of things to choose from. And once you go gluten-free and dairy-free, your taste buds will change, and the things you didn't like before, suddenly you are craving things like Brussels sprouts and lima beans. And I'm just thinking of some of the things that I used to not like, and now I can't get enough of them. So food is medicine, and we treat it as such. 5 years ago, I removed all grains from my diet, including rice and corn. My intestines healed up. My neurological symptoms completely went away after a couple more years on a paleo diet. And I no longer have balance issues. I can walk in a straight line. I have no problem with falling, which, believe it or not, as a 40-year-old woman, I was falling quite a bit, very disconcerting. And you too can find out if celiac disease or gluten intolerance are causing you health issues. Because if they are, it's a simple diet change that will sometimes remedy those symptoms and make them go away. Otherwise, the progression of those symptoms never really ends well. It doesn't get better on its own. Medications are self-limiting. We're only treating people with those medications. They're not curative. The only thing we really know is that if you can change your diet, there's a good chance that some of your symptoms will either stop getting worse, so we'll slow the progression, or they might go away. Everybody is their own experiment. That's the beauty of it. Everybody has their own factors to keep in mind, and your gluten-free, dairy-free diet is different than what I would think of a gluten-free, dairy-free diet. My paleo diet is definitely different than other people's paleo diet because I can't eat eggs at the very least. And plus I eat some different things that other people wouldn't eat. So one of the good things to know is that once you are healing up your intestines, which includes your enteric nervous system, and your constipation goes away, sometimes relatively quickly, which is a good thing, your body begins to improve. Your villi grow back, which takes 6 months to a year. You absorb nutrients appropriately. Hopefully, you're working with a practitioner that is making sure that you have had a nutritional panel, which should include a B6, B12, maybe a copper, magnesium, RBC, CBC, chem panel. There's many different labs that should be done, and I do say should, because based on worldwide recommendations of lab work that should be done on a newly diagnosed celiac person or for follow-up, it's all standard. It's not really an option. We have to find out what your baseline is, and then for these levels, including zinc, and then find out maybe what you need to supplement with for either a period of time or for long term. Again, every cell in your body wants to heal, it wants to get better, but we have to remove the things that are causing damage and then replace the nutrients that your body needs to heal itself. This is not hard. Eating, everybody has to eat. And what we decide to put on our plate and to actually consume is very important. And you are very powerful as a consumer of food, as an eater, as somebody that goes to the grocery store and purchases products. Be very careful what you purchase because you're sending messages to food producers and grocery stores about what is important to you. So I myself am a big advocate of eating everything organic, which means it's not sprayed with pesticides and herbicides, and local products, mostly fruits and vegetables, making sure that everything I eat for the most part is organic. That's really important because even in the absence of celiac disease, glyphosates or the Roundup itself can cause a leaky gut, which we know celiac disease causes leaky gut or increased permeability of the intestinal wall. Well, even in the absence of celiac disease, the conventional or the products that have been sprayed with glyphosates can cause that same damage. They can cause leaky gut, which will allow bacteria and parasites and viruses and food particles to actually be able to get through the intestinal wall and into your bloodstream. That's never a good idea. And once you have a broken intestinal wall, you also have a leaky blood-brain barrier, leaky lungs, leaky skin, because it's all epithelial tissue. It's really important to recognize that because the goal is to help our body heal. And not just our intestines, but our entire body system, our entire being. What does it take to do that? Frequently, change your diet. Most of my people that have successfully changed their diet and hopefully gone on a paleo diet no longer take prescription medication. Their blood pressure is great, their cholesterol is great, they're absorbing nutrients appropriately, and their body heals. Doesn't happen for everybody. But the vast majority of people that are strictly on a at least gluten-free, dairy-free diet have the best chance of healing their intestines and their neurological system and their skin. It's great. Again, there's always damage that is done that sometimes we can't heal, but we don't know that until we try. It's a clinical trial. And everybody being their own science experiment, it's fun. There's lots of variability, and we get to see what happens over time. When people get better, that's amazing. The kids, especially when they're distracted or they have a hard time focusing. A lot of the kids I've worked with have been on IEP plans, individual education plans, I should say, but they're now doing advanced placement math and science. They're on the honor roll. They can focus. They're much better students. And you know what? I would love every student to have an opportunity to be the best student they possibly can be, because these are the kids that are going to be taking care of us when they get a little older. I want our children to be smart and motivated and focused and to be the best people that they can be. So if you have any questions, please call me or contact me on my website. It's Nadine at glutenfreern.com. But today we talked about the neurological symptoms associated with celiac disease and non-celiac gluten sensitivity. An inflamed brain is never a good idea, never a good plan. So we want to make sure that we're taking away that inflammation. Sometimes it's chronic inflammation. Thank you again for joining me for episode 12 of the Gluten Free RN podcast, where we talked a little bit about the neurological components of celiac disease, how it can affect your balance, how constipation is really a neurological issue for some people, and maybe most people. We don't know yet. And how you can get better. If you have any questions, please give me a call. Stop by my office. Email's great. And if you like the Gluten Free RN podcast, please look it up on iTunes and leave a review. It helps direct other people to Gluten Free RN podcast. And it really helps give me some feedback to know if what I'm talking about is helpful to you. And thank you, really a huge shout out to all the people that have already given reviews or given me feedback about what they would like to hear on future episodes. So join me in the next episode of the Gluten Free RN podcast. Until then, thank you very much. And I will be back with more information on celiac disease, non-celiac gluten sensitivity, the paleo lifestyle, and how you and your family can benefit. Have a great day. This is Nadine Gruskowiak, the Gluten Free RN, signing out of episode 12. Stay healthy, eat healthy, be healthy.